Jalup jatend piny Kithure Kindiki otelo chenro mar weche thieth matudo kaunti kod piny owacho mamalo e kar jot ma Karen. Romono menyo yudo yore mag bero sekta mar thieth kod okenge mag bero kumba mag thieth e bwo chenro mag Taifa Care.
Today's meeting provides a platform for us to jointly discuss, learn, innovate and share experiences on health by fast-tracking our journey towards universal health coverage. Additionally, meetings like this will foster intergovernmental coordination and cooperation, thereby making the national and county governments to be more effective and efficient in their roles.
This meeting also will be expected to deal with the issue of the capability of our health institutions and health facilities to provide the required services, and therefore the National Equipment Support Program and how we again expedite the outstanding issues around ensuring that our health facilities have the necessary capabilities to deliver services is part of the outcome for this meeting. In terms of registration, we seem to be making good progress. 19.5 million Kenyans are already enrolled. And for the avoidance of doubts, out of the 19.5 million Kenyans, all of them are enjoying primary health care, which the government is providing free of charge. We need to do some work to make sure that as many people as possible who have registered